In this lesson, we're going to talk about the facility, personnel, and resident buttons. But before we do, let's look in the upper right-hand corner, and you'll see that it's telling us a little bit about ourselves. We're a level 1 nurse, logged in as Sue Flower, and the patient facility is the test nursing facility. Of course, this isn't real data because that wouldn't be HIPAA compliant. So we'll tap on facility, and up comes everything that you'd want to know about that facility. You can edit the facility. You can place an order for the facility. That would be a stocking order. We're going to talk later about how to order for a specific wound. You can search for orders, show your orders, look at eval forms, and other things that we'll look at later too. Notice the finalize eval orders. This is going to be an important button that we'll discuss further later, but it's basically there because in our experience people will do wound rounds and then they'll realize that there are certain corrections that they want to make. And the way that computers work is that they can process very, very quickly, and orders will be shipped and all kinds of things would happen before people generally discover that they need to make corrections. So this is a button that you would come back to after you've done evaluations to say, yes, I am certain that I've got everything in order, and we're going to finalize these evaluations and place the orders. Okay, if you wanted to edit the facility, simply tap on that, and you can change all the attributes of the facility. This is largely there for you, but there are certain things that you might want to look at, like the last day of the week used in reporting. So we can end the reports on any day. Usually people like to end them on a Sunday, so it's Monday through Sunday. And as you change things, you can tap on the update button and finish editing the facility. Let's move on to personnel. Now, remember, we're logged in as someone from a particular facility, so if it's a chain, someone could log in and see more than one facility if they had that kind of permission. But generally, this is how a nurse. This is what a nurse would see. So we see all these different kinds of people: level 1, level 2, physicians. There are other types of people who might have access in this facility. And remembering that we have context-sensitive help, let's click on the help button, and here's information on how do I edit personnel in my facility, and further, how many kinds of personnel are there. So we click on here, and you can see that that question is answered. So just once again, there's all kinds of information that's available to you in the context that you're using Fastcare. If you wanted to add someone to a facility, you'd click on the Add Facility Person and fill this out. You can set the password and then save the user. We're not going to do that right now. And let's take a look at the residents too. So when I tap on the resident button, up come all the residents. I can scroll them up and down, and they are sorted by last name. If I wanted to add a new resident, I would click here. If I wanted to take a look at Betty Boop, here we are. Notice there's a picture of Betty Boop. You don't have to have a picture, and really not everyone uses this feature, but it's there if you want it. You can also take a picture of the face sheet. So these 3 buttons over here allow you to take a picture of the face sheet and a picture of the resident. And then it says Show Uploaded Pictures. Well, why does it do that? Well, it takes a couple of seconds for a picture to be taken and go up to the Fastcare database. Remember, none of this data is being kept on the tablet, and that's to your benefit, because if the tablet is broken or lost or for any reason is impaired, even during wound rounds, that information is immediately on our servers, and that's another way that we maintain HIPAA compliance, because that data can never get away. It can't even be taken on a tablet. So as soon as the data is collected, it's encrypted and sent to our servers. Well, it takes a couple of seconds for a picture to go up, and then when you tap on Show Uploaded Pictures, then the pictures are refreshed. So if you wanted to see the resident information and maybe edit it, you could click on Edit Resident, and you see here's a picture of not an actual face sheet, but a piece of paper that looks kind of like a face sheet for purposes of this demonstration, and you could pretty easily collect information from there and put it over here into the edit resident information. So you've got admission date and billing information, physician information, and finally a few allergies to sulfur, collagen, and tape. We don't keep all of the possible allergies, but these are just a few things that you might want to be aware of in a wound setting. And of course, you'd tap on the Save button to save the information. Let's go back to the resident by just hitting the back button. This is where you would evaluate a wound, and we're going to look at that more in the next lesson. Betty Boop has a leg wound. You can see there as a picture of a leg wound. Now, most facilities don't use pictures, but if you did, this is a good way to have a record. And if you're looking at a picture, the way to get it to go away is just to tap off of it. So you tap on the picture and then tap on the side of it, and it will go away. If you want to send a comment to a Gentell wound care specialist for a recommendation, you can type something in here, and then ask a Gentell wound care specialist for a recommendation by sending this, and you should get a follow-up within an hour or two. So click here on the wound history. There was one record here, but if there were a number of weeks, the records would be stacked up, and we've set this up to make it pretty easy to print out the wound record. So there's your wound history. This button allows you to manage pictures. Sometimes people have trouble taking pictures, and if there's a picture that you don't like, you can select it and delete it. We're not going to do that right now, but you do have the ability to manage your pictures. Similarly, here's where you would take the wound picture, and then once you've taken it, give it a couple of seconds and hit show refresh, and the picture will show up there. So those are the main issues with the facility, personnel, and resident buttons.